we're competing with every other community that has that need as well. So just be aware of that. Within the county, we are looking at what other types of facilities or spaces that we could make available if we needed to isolate or quarantine people who may not be able to do it in their homes. So we are exploring all of those options right now, and are very far along in the planning on all of those issues. So again, we are lucky in that we have not come across that situation yet, and we still have time to continue to plan and implement. But I feel good that we are having the conversations and know how we're going to react if it happens.
Okay, thank you so much. I really appreciate you guys letting me ask a few questions. Thank you, Mr. Chairman.
Thank you. All right. First of all, I want everybody to know I'm under the same 7 minutes. So I have 3 questions, and they're really, I think, for the benefit of this board. Given what we have discussed over the period of the year and several months that we've served together, there are a number of issues that have come up, and some of us didn't really understand that. So this is the perfect teaching opportunity to deal with that. Number 1, Emergency Management Director. You are given a specific role as you responded to a question that was asked. You said, that's the role that I've been given. So would you please explain to the board and to the community what happens once a declaration is signed by the chair and the mayor?
Okay, so there are a number of different, well, there's several different declarations that can be signed. Obviously, the governor has signed a state of emergency, as has the federal government, and now both the mayor and the chair of our board has signed a declaration of emergency for Mecklenburg County. What that does for us, number 1, it just solidifies the organization of emergency management and the EOC as our coordinating effort in this community around the work that we do, but it also allows for a freer flow of resources from the state and the federal government, as well as gives us a little more say as to how resources are used in this community to combat the situation. So it just increases our ability to be more organized and to have better access to resources.
Thank you. Along those same lines, we've had discussions previously about the difference between a consolidated board versus a board of health.
Yes.
Had we had a board of health, talk about the difference in how you would have had to operate.
I'm going to let legal talk about that.
Complicated question.
It's a complicated question, but
under consolidated human services model, you vest the authority with the spokesperson. Here would be Ms. Harris. If you're looking at a board of health, you've got to get the board to act and react. So it really hampers the process, which is what the thought was behind the board when we consolidated to pull these services together, that you have a focal point who can make the decisions. When a declaration is entered by the governor or by the Board of Commissioners, it empowers the health director to do things broader than just quarantine or isolate. It allows her to do things that are more broad, whereas you had the Board of Health, you have to go back and get approval. So here it gives more guidance and I think more flexibility for the health director to act more expediently than if you had to go through a board.
I just thought this was the perfect opportunity to explain that, because we had that discussion and there were people teetering on both sides of why we had what we had. And I just thought what happened during this incident was a perfect example of why it was so important for us to have the consolidated board. And then the last thing, this board has oftentimes talked about how much we have in reserves and how we should spend our reserves down. To me, this was another perfect example of why the county has the reserve funds that it does have, because we can't spend them in both places. We can't spend them down and then expect them to be available in emergency situations like this. I had this conversation with Commissioner Harden earlier today, and she said, I yield, I give, you're right. So Dina, would you talk about the ability to make the recommendations and decisions that you've made, given what previous boards have done to reserve funds and make them available for times like this, and futuristically a recession, which is probably more likely than not?
Correct. So our fund balance policy is very specific in that the money needs to be used for one-time non-recurring expenses, but there's also an emergency provision in our fund balance policy that allows us to use fund balance for operating expenses when we have a financial crisis, to allow us to be able to maintain service levels. There's also a provision in there that says that we have a payback responsibility. So if our fund balance gets below the threshold that we've stated, which is 28% of revenue, then we would have 2 years to repay that to get us back up to our reserve level. The good news is that we're not at risk today of falling below that threshold. So we do have the opportunity, if there is a recession, to use our fund balance to maintain service levels and not have to do what we did in the last recession, where we had to lay off 10% of our workforce in order to make our budget balance. So I think we're in much better position now because we have those high level of reserves than we were back in 2010.
And then lastly, I just want to say to my colleagues, I really appreciate the questions that were asked. There were things that I wondered myself, and from the questions you raised today, I was even more enlightened, because I tell you, this is a whole lot to get your head around. And so thank you for the questions that were raised. Thank you, Gibbie, for your willingness to answer and respond to those concerns, and to the rest of the staff as well.
Thank you, Gibbie.
Thanks.
I think she's going to go off now and talk to the media and see if they have any additional questions. So with that, I'm going to go on to the third item under my manager's report, which are the three other additional items that I asked you to act on. I put those in my series of emails, and I'm going to kind of walk through that now. The leadership has worked diligently to implement alternative staffing models to support county needs and reduce exposure to the COVID-19 virus. We've revised our telework policies to expand the number of employees that can work from home. Our goal is to have as many employees as possible that can work from home do so, and that will actually start tomorrow. We're also proposing an emergency leave policy that would provide employees the ability to take time from work and not use their current leave time. And finally, we are eliminating certain face-to-face public transactions if there are safer alternative methods. In order to proceed, I'm requesting that the BOC approve the following three items. One is adopt an emergency paid leave policy for up to 80 hours of emergency paid leave related to the coronavirus effective March 16, 2020. All Mecklenburg County employees would be eligible, including full-time, part-time, and temporary employees. Full-time employees will receive 80 hours, and part-time employees will receive the equivalent of their 2-week work group scheduled hours. Eligible use: an employee or an immediate family member is quarantined or isolated for COVID-19 and is sick or exhibiting symptoms. If Mecklenburg County suspends any business function and cannot provide an alternative work option to the employee of the suspended business function, including telework, alternative work site, or redeployment to another business function, or if an employee is unable to work due to COVID-19 school or child care emergency closing, impact his or her dependent children, and the employee does not qualify to telework. In terms of carryover, any unused emergency paid leave hours will carry over, but is restricted from pension earnings, termination pay settlement, and vacation cash out. reauthorization, based on an assessment of the situation, the county manager may reauthorize emergency paid leave as circumstances require. Number 2, affirm the accelerated purchase of or any unused emergency paid leave hours will carry over, but is restricted from pension earnings, termination pay settlement, and vacation cash out. Further reauthorization, based on an assessment of the situation, the county manager may reauthorize emergency paid leave as circumstances require. Number 2, affirm the accelerated purchase of 600 laptops, peripherals, and docking stations in the amount of $1,072,148.36 to allow telework for county employees and call centers. In addition, appropriate $173,300 for equipment deployment support. Funding for this is from the general fund. Justification. Most of this request is an acceleration of computer equipment slated for evergreen replacement in the upcoming FY '21 budget. In addition, mobile laptops and headsets for call centers will provide needed telework flexibility for the COVID-19 response and future emergencies. The third thing we're asking you to approve is order the tax collector to suspend in-person tax payments during the COVID-19 state of emergency. North Carolina law requires that tax collectors accept national currency for payments per North Carolina General Statute 105-357A. However, in consultation with the North Carolina School of Government, the county BOCC can eliminate in-person tax payments so long as taxpayers have other reasonable options for timely payment. Taxpayers may use alternate methods as permitted by North Carolina General Statute 105-357B, including paying online, by telephone, or mail. These methods currently exist for Mecklenburg County taxpayers. This order to suspend in-person tax payments during the COVID-19 state of emergency will have minimal impact on taxpayers, as Dropbox collection boxes will still be available at Valerie Woodard for taxpayers wishing to pay with currency. And I can certainly answer any questions that the board may have, but those are the 3 actions we're asking you to approve tonight.
Mr. Chairman, I move for adopting the resolution, for approving the purchase and for authorizing the temporary suspension of in-person payments.
Second, Mr. Chairman.
All right, thank you. Thank you, I really appreciate that. All right, all 3 action items are being moved for approval. It's been moved and properly seconded. Any further discussion?
I do have a question.
Yes, sir.
Mr. Chairman, Manager DiOrio, I thought I heard you say 600 laptops, not the 850?
Oh, I apologize. It's 850.
It is the 850.
850. I apologize. Yes.
Okay, and then, and I thought you had mentioned a lower number, 1,072,000. This says 1.57.
Yeah, my talking points are not up to date. I apologize. It's $1,547,148.36.
Okay, all right. So I'll
As
amend my
amended.
motion.
All right.
Thank you.
All right, any further discussion? Hearing none, all those in favor of the motion, let it be known by saying aye. Aye. Any opposers?
Aye.
Any opposers? That's Commissioner. She's voting for it. Any opposers? The ayes have it, so carries the motion.
So one other thing, I want you to know that we have prepared a news release. It's very extensive about all county services and how.
We need that.
Yes, I'm going to get it to you. How residents can access services for the foreseeable future. So we will make sure that you get this in your email, and you should push this out through all of your social media channels and your network so that the community knows exactly how to access services during this time. We are doing this for a 2-week period, but I do believe, based on conversations that I've had with Gibbie, that will ultimately be extended. I think 2 weeks
Why is it
is.
so long?
What?
So much information.
What's so
No,
long?
no, I'm seeing the
Because basically what we are doing is we are changing
pages.
the way services are going to be delivered over this period of time. And so people that normally come in to access services in person are going to have to access them differently. And this is the document that explains how those services will be accessed. It will also indicate which services will not be able to be provided because they require face-to-face. And we are not going to be putting our employees at risk of providing face-to-face services unless they are mandated to do so, like Commissioner Cotham mentioned, around child protective services and other things where they're required to do mandatory home visits.
Okay.
But we will make sure you get this document ASAP tonight.
5 copies?
Excuse me?
Hard copies.
Of course. How many would you like?
I'll talk with you later.
Okay, but I'll get somebody to start making those copies while we're in the
Thank
meeting.
you.
Yes, Commissioner Powell?
So that we have clear, consistent communication, that will be on the Mecklenburg County website, correct?
Yes, it will.
Okay, because I think that's the most important thing, instead of, getting a message from multiple people. I think if we just steer everyone
That's right.
to the Mecklenburg County website, I think that's the smartest thing.
And we also are doing a joint release that the Emergency Operations Center is going to do a joint release with our information as well as the cities.
City.
So that there'll be one communication from the Joint Information Center about the impact to city and county services, and that is being prepared.
Is that also being done for the 6 towns?
The 6 towns are also, they are also plugged into the Joint Information Center, and they are supposed to be putting their information into the JIC as well. So that, again, that's why we have this infrastructure, so that all that information can be consolidated and communicated out simultaneously in a consistent way.
All right.
Commissioner Cotham.
Is it possible to get that in Spanish also?
We can do that. I can tell you that we've had some challenges getting some of our posters and flyers translated. It's taking a little bit of time, but I think that's a great suggestion, and we will send it to our translation folks to see if we can get it done quickly.
Mr. Chairman, can I ask one more? One last thing that I wanted to ask. I've had a lot of calls from homeless people who are, with all the restaurants closing and the libraries closing, that they don't have a place to go to the restroom. Is there any way we could get some porta potties like they have during the parades, maybe and station them uptown?
So that's a great suggestion, and we will put that again to the homeless group.
Attaches to it? I just ask you to think about that. Thank you.
I will tell you that we are not closing the restrooms in our parks. We've had that conversation, and I've said that would be unacceptable. So to the extent that we have restrooms at Romere Beard and at First Ward, those will be available, but I think that's a great suggestion, and we'll certainly take that back.
Okay, thank you.
Thank you. Is that the end of your report?
That concludes my manager's report. Thank you very much for your support.
All right, thank you. Before we move on to our awards and recognition, there is some unfinished business from our earlier session. The chair will entertain a motion to authorize the county manager to negotiate and execute all documents necessary for the acquisition of tax parcel 169-151-01 through 169-151-5-155-35 from Mary F. Langford for a purchase price of $372,626.59. And under the same motion, to negotiate and execute all documents necessary to purchase tax parcel 169-55-36 on, to present a proclamation.
Thank you, Mr. Chairman. So in the midst of everything that we have going on, we're still conducting business and still presenting recognition. And so tonight we have a proclamation for the Red Cross. And we have the regional CEO, Hugh Quinn. So when you look at their mission statement, and the American Red Cross prevents and alleviates human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. And I particularly love the vision statement. The American Red Cross, through its strong network of volunteers, donors, and partners, is always there in times of need. We aspire to turn compassion into action so that all people affected by disaster across the country and around the world receive care, shelter, and hope. Our communities are ready and prepared for disasters. Everyone in our country has access to safe, life-saving blood and blood products. All members of our armed services and their families find support and comfort whenever needed. And in an emergency, there are always trained individuals nearby ready to use their Red Cross skills to save lives. So we know about the Red Cross. A lot of people take it for granted, and I am happy to present this proclamation tonight. And it reads, whereas nearly 140 years ago, the American Red Cross was established as a humanitarian organization guided by the fundamental principles of humanity, impartiality, neutrality, independence, voluntary service, unity, and universality to provide services to those in need regardless of race, religion, gender, sexual orientation, or citizenship status. And whereas today the American Red Cross is the largest humanitarian organization in the world and delivers its mission every day to prevent and alleviate human suffering. And whereas every year the American Red Cross responds to more than 60,000 disasters across the country, including mudslides, wildfires, hurricanes, and tornadoes. And whereas thousands of American Red Cross volunteers provide shelter, meals, and relief items around the clock to disaster survivors. And whereas the Charlotte Metro chapter of the American Red Cross, which includes Mecklenburg County, assisted nearly 900 people and responded to close to 200 local disasters in fiscal year 2019. And whereas March is American Red Cross Month, which is a special time to recognize and thank American Red Cross volunteers and donors who give their time and resources to help members of the community. Now, therefore, be it resolved that the Mecklenburg County Board of County Commissioners does hereby proclaim March 2020 as American Red Cross Month in Mecklenburg County and encourage all citizens to join us in this special observance this 17th day of March 2020. Signed, George R. Dunlap, Chair, Mecklenburg Board of County Commissioners. Mark D. Jerrell, District 4, Mecklenburg Board of County Commissioners. So moved, Mr. Chairman.
Second.
Been moved and properly second. Any discussion?
I have some, Mr. Chairman.
Commissioner Lee?
I belong to the African Methodist Episcopal Zion Church, and at a conference I attended just in June of this month in Greensboro, Bishop George E. Battle informed the congregation that was there, over 2,000 of us there, that he had lost some degree of respect for the Red Cross. I'm giving it to you like he gave it to us as our spiritual leader. And the concern that Bishop has is the non-support of minority black people in areas where they have been involved in tornadoes and other national events that has been negative to communities, that they have served them later than they have the others in different communities. I did not question him as to where he received that information. But several months ago, there was an article in the Observer pertaining to the American Red Cross and its work. I'm only giving it to you like it was given to me at our meeting in Greensboro in June. And he asked us to always speak up to those issues whom we believe that's not doing enough for some people as they do for others. So that's what, and I did speak to Mark Jerrell before the reading of this proclamation, so he would know that I was going to lift that up.
All right, you've heard the concerns. All those in favor of the motion, let it be known by saying aye. Aye.
Aye.
All right, she voted in the affirmative. All opposed?
I have to say nay.
Okay, that's 8-1. All right.
I also opposed.
Oh,
I was opposed. Yeah, I opposed.
7-2.
7-2. Okay. All right.
Thank you. I appreciate the opportunity to be here. Thank you for the proclamation to the American Red Cross, the Charlotte metro area. I appreciate that very much. I'm Hugh Quinn. I'm the interim regional executive for the Red Cross for Charlotte and most of the western half of North Carolina. With me tonight is our future regional executive, Allison Taylor. Allison will be here officially in the role as of April the 6th, April the 6th. Ma'am, I'm sorry for that
My
experience.
name is Vil Malik.
Excuse me?
My name is Vil Malik.
Okay, I'm sorry, okay.
That's right, I probably can't see that far.
Well, I can't, so thank you. Ms. Leek, thank you for those comments. I don't know anything about the specifics of what that is about, but the Red Cross has had a non-discriminatory policy ever since its beginnings, and we are a neutral, independent organization. We always have been. We strive to serve everyone in society when they have an emergency, a disaster. There's no discrimination displayed towards anyone. We provide the same level of assistance to families across all disasters based on the size of their family and based on their needs. So I'm sorry that experience happened, and I'd be happy to try to explore that more if I got more details later on. But thank you.
Sir.
Thank
We'll
you.
meet with you.
I've got a few remarks I'd like to share. A few things. It's the. I want to share. You gave us some statistics from the Red Cross in 2019. I want to bring you more to the current, where this fiscal year is July through February. Our fiscal year is July through June. So July through February, we have continued to serve our U.S. military and their families through emergency communications. We've been doing this since the early 1900s, where Red Cross personnel are stationed with U.S. military personnel all across the globe, wherever there's a major military installation, including in battle zones, war zones. Locally, we have provided 189 families, as well as with emergency services, as well as 422 other families with local needs. 842 military members and their families have attended mental health workshops with the Red Cross, and we have briefed over 8,800 local people in what the Red Cross does for military families. Disasters, since July, we responded to 154 disasters in Mecklenburg County. Most of those are single-family home fires, where people's homes, most of the time it's a cooking fire that got out of control, or in the wintertime it tends to be more heating fires, where furniture was too close to a space heater, and that caused a fire in the homes. But so far, we responded this year to 154, including the tornadoes that hit Charlotte in early February of this year. We had several tornadoes strike different communities in Charlotte, and Red Cross was there to support those families that needed it. In fact, altogether we've assisted this year so far 667 people and provided $143,000 in direct financial assistance to these families. We're obviously very involved with COVID-19 as well from a preparedness side. We're providing a lot of information through our resources in the community. And I want to talk specifically about another area of Red Cross. So far this year, we've collected 18,248 units of blood at 725 drives through February. That's the good news. That all changed a few weeks ago. With the COVID-19, since then, we have lost 52 blood drives and approximately 1,540 units of blood since the 1st of March. The hospitals nationwide, I want to give you an item for nationwide. Nationwide, the Red Cross has lost in excess of 80,000 units of blood since the beginning of this month because of COVID-19 and people not being able to donate regularly. Many of our drives in the springtime are at schools, high schools, and colleges and universities. All the high schools are shut down. All the schools are shut down now. So we had drives scheduled coming up for the next month or two. Those are not in the books anymore. And we also, many businesses, as we know, have allowed their employees to work from home, telework. And where we normally have drives at different businesses, that's been reducing our numbers as well. So my concern, and I hope it's the concern of everyone in our community, is that we have the crisis with COVID-19 affecting the entire society. We're going to have another crisis if there's not sufficient blood in our hospitals across Mecklenburg and all the communities around this country. That many cancer patients require blood transfusion, platelets for help with their treatment of their cancer. Accident victims, people having surgeries need blood. And so we're all encouraging people to donate blood. We're trying to avoid another crisis. We have the COVID-19 crisis going around America. We don't want to have a blood crisis when you or your family members or friends have to go to the hospital and there's not blood on the shelves there for them. So I would like to encourage the entire citizens of Mecklenburg County who are in good health to consider donating blood and going to the redcrossblood.org website. Redcrossblood.org is our website for donations. They can go there and sign up, find when the nearest blood drive is going to be, and sign up and be able to do that. Because we've lost so many high schools and other businesses from donating, we're opening up our fixed site center here in Charlotte at more hours. We're also identifying other sites around the community that we can go into and opening up and asking donors to come into those sites to contribute, to donate blood. I'm deeply concerned about the potential issues that the society could face if there's not enough blood in our hospitals when the patients need them. And that is, we have a unit of blood is good for 42 days after it's donated. After that, no blood is not being used right now. Every unit of blood that comes in is being used in the patient in our hospitals. So I would really encourage the citizens of Mecklenburg County to consider donating blood. Healthy individuals that have to be at least 17 years of age to be able to donate. And there's a lot of healthy people out there, but they're staying home right now. And so we're trying to encourage them to come out and donate blood. And I would ask you as members of the County Commission to consider donating blood yourselves, and also consider asking the employees of the county to consider donating blood as well, because we really, as a group, we need to come together on making sure we have blood in our hospitals. So I appreciate the opportunity to come tonight. I thank you for the proclamation. We appreciate all the support we've received from the county. And Red Cross has been here for over 100 years in Mecklenburg County, and we're going to be here for hopefully another 100. So with that, if there's any questions, I'd be happy to try to address those. Yes, ma'am.
Commissioner.
So thank you for the request for blood, and I'll certainly put that out on my social networks. Can you, is there information that you can provide in terms of what you're doing to isolate people who will come in so that they
Yes.
won't be exposed to lots of people when they come in? So
Yes.
will you post on your website so I can direct people to
Okay.
the protocol that you're using so that people will not be,
Right.
because, they're getting conflicting information, right? They're getting
Right.
conflicting information to stay at home.
Correct.
And then you're asking them to come out of home to do that
Right.
for something that's it's not required, so I think people need assurances that by doing that, they won't be exposed to the virus.
Sure. That's a great suggestion, and we'll make sure the latest information is on our website before they come into work. And if it's 99.5 degrees or above, they're not coming into work that day. At the blood drives, we screen every person there by asking them a series of 4 or 5 questions about whether or not are they feeling well today, have they had any symptoms, things of that nature. And then we're also taking their temperature before they even enter the donor process. And so their temperature, once again, for a donor has to be 99.5 or lower before they're going to be eligible to be donating that day. Once they do those steps, then they move into the donor process and they go through and make their donation. And there is no evidence that the coronavirus has been spread through blood transfusions. There's no knowledge of that worldwide at this point in time. So we don't think that's an issue at all. But we want healthy people to come in and donate. So we don't want people with seasonal allergies or flu, or obviously the people that have come down with this virus. So we are taking a lot of precautions with our workforce and with the donors that come into our facilities.
Commissioner Jerrell.
I just wanted to say, Hugh, thank you so much. Hugh's been
The county and the city on brain injury, and I've asked our vice chair to read that one.
This is a proclamation from the City of Charlotte and Mecklenburg County. Whereas acquired brain injury is a serious national public health epidemic resulting in long-term or permanent disability or death, which includes strokes, brain aneurysms, brain tumors, brain infections, anoxic brain injury, and traumatic brain injury. And whereas acquired brain injury is overlooked, underfunded, and affects thousands of North Carolina citizens, stroke is the leading cause of adult disability in the United States, and there is a brain aneurysm rupturing every 18 minutes. And whereas brain injuries occur when there is a lack of oxygen supplied to the brain and cardiac arrest, near drowning, choking, and drug overdoses may cause anoxic brain injury. Each year, approximately 70,000 people in the United States are diagnosed with a brain tumor. And whereas more than 2.8 million Americans suffer brain injury every year, and of those, 50,000 die, 282,000 are hospitalized. Seatbelts, drive carefully, and wear a helmet, even if you're just riding down the driveway. Wear your helmet. Thank you. Move to approve.
second.
Been moved and properly second. Any unreadiness? Discussion? Pat?
Thank you. Thank you for reading that, Elaine. I believe this, I just wanted to recognize our colleague on the City Council, Renee Johnson. I believe she's the one who prompted this. And I learned a lot about brain injuries from meeting Renee a few years ago in court with her son. And he had suffered a brain injury. And Renee has been so dedicated and has worked so hard, and she's a true advocate for brain injuries and has made if her son, he was blessed to have great parents, and Renee has done a wonderful job advocating for him, and he's doing fine now, but he certainly has had a lot of difficulties, and he's a brave young man. But I'm so glad that I had the opportunity to learn from her about brain injuries, and I just want to congratulate her for all that she's done and for her leadership on the City Council on this. So thank you, Mr. Chairman.
All right. Having been moved and seconded, all those in favor of the motion, let it be known by saying aye.
Aye. Aye.
All right. You got it. Okay. Any opposed? The ayes have it, so carries the motion. Renee is not with us tonight, but we will make sure that she gets a copy of this proclamation. We'll move now to our public appearances. Is there anyone scheduled?
There are no speakers.
Thank you. All right, we'll move to our next item, which is our public hearing. Again, these are items that we have already approved, and so they'll come forward now for the hearing. So the chair would entertain a motion to open a public hearing to receive comments on a proposed business investment grant for TerraTech Multicom LP. Is there such a motion?
So moved.
Is there a second?
Second.
Moved and properly second. Any unreadiness? Oh, I'm sorry. All those in favor of the motion, let it be known by saying aye.
Aye.
Any opposed?
Aye.
The ayes have it. The hearing is now open. Is there anyone who has indicated they want to speak at the public hearing? No speakers.
Oh, you mean public people?
Public speakers.
Right.
Okay, you can't do it, okay.
All right.
Mr.
Unless,
Chairman, as usual, thank you for being here this evening, and thank you, Manager Diorio, for giving us this opportunity on both of these BIPs. I do have my typical presentation in deference to you. I can go through the presentation, but again, this is something that you've already seen and voted on in closed session. Would you like me to go through the presentations, or would you like to move just straight to a motion?
all right, colleagues, what is your desire? You've already seen the presentation. Nothing changed.
Nothing has changed on either of these, sir.
The salaries didn't increase, I know it's 35,000.